Okay, active versus passive euthanasia. For your essays, you all look you all took a long hard look at Bovia versus Superior Court, which involved a young woman who wanted doctors to remove her feeding tube, even though this would very likely lead to her death. The doctors didn't want to remove the tube in part because they thought this would have been a form of euthanasia. Euthanasia, which means good death, is the subject of Rachel's essay. Euthanasia comes in in which um, two forms which can be illustrated by examples you're aware of. The Bovia case is one of those examples. As you know, Elizabeth Bovia won her court case, and hence we all know now have the right to refuse treatment even if the likely consequence is death. You may have also heard of Dr. Jack Kevorkian, who engages in what is typically called doctor assisted suicide. He had a machine which poisoned patients who expressed a desire to die. These patients had an incurable and terminal illness, and Dr. Kevorkian thought it was compassionate and preserving of human dignity to enable patients in such situations to die as peacefully and painlessly as possible. In some states, such as Oregon, doctor assisted suicide is legal under specific circumstances. Rachels begins his essay by distinguishing between two types of euthanasia. There is passive euthanasia, which involves the deliberate rejection of a life preserving treatment, and there is active euthanasia, which involves the deliberate killing of the patient, usually by poisoning him or her. Passive euthanasia is legal in all states and is generally considered to be morally superior to active euthanasia. Some people think that when we commit passive euthanasia, it's actually the disease and not the doctor and patient which are doing the killing. Refusing treatment can be thought of as letting nature take its course. It's especially plausible that passive euthanasia is morally acceptable when the patient is suffering tremendously from her illness and the treatment in question is likely to prolong life but not cure the illness. Active euthanasia is looked at with much more suspicion, especially when doctors are involved. When a doctor and patient commit active euthanasia, the doctor and patient are clearly the ones who are bringing about the death of the patient through an intentional act. This renders active euthanasia an act of deliberate killing and is hence more likely to arouse our sense of moral impropriety. Rachels argues that it's a mistake to think that there is a morally significant difference between killing active and letting die passive. As just noted, Rachel's thesis is that there is no significant distinction between killing someone and merely letting that person die. Hence, when we use this distinction to think about various cases in medicine, we are led to pursue courses of action which do not make any sense. Rachel's has us consider a person with incurable throat cancer. The patient is in terrible pain, which can no longer be managed by medication, and is likely to live only a few days even if the present treatment is continued. Now, should the doctor only agree to discontinue treatment and let the patient die? Or should the doctor fulfill the patient's request to be killed by being poisoned? Rachels notes that merely letting the patient die is likely to result in a prolonged state of intense pain, whereas simply killing the patient will hasten his death and thus prevent further pain from occurring. Rachel thinks that the compassionate thing to do is end the patient's life of agonizing pain quickly. Only the person who thought that killing is worse than letting die would think otherwise. Hence, to think this is a mistake. Rachel's second argument. Rachel then provides us with another type of real-life scenario in which people have been misled by the killing, letting die distinction. He notes that 1 in 600 babies are born each year in the United States with Down syndrome. Some of these babies have ailments which will cause them to die pretty soon after birth if they are not fixed. He focuses on the example of an obstructed intestine. Parents, in conjunction with the doctors, often decide not to operate on ailments such as an obstructed intestine and simply let their baby die. What they do not do is take steps to kill the baby quickly. Hence, the baby is left to suffer until the obstruction kills her. Now, you might think that it's wrong to let the baby die or kill the baby in such a situation. Rachel's does not actually say whether or not he agrees with you if you think this. What he does say is that the distinction between killing the baby and letting him or her die distracts us from the main issue. The main issue should be, is it ethical to fail to keep a Downs baby alive? If the answer is no, then both active and passive euthanasia should be prohibited. If the answer is yes, then we are back to Rachel's first argument. It would be more compassionate to end the baby's life quickly rather than let her starve. Rachel's third argument. Rachel's has one final argument in defense of the view that killing is no worse than letting die. He has us consider a case in which both are clearly wrong, and yet one is no worse than the other. Smith and Jones are in a similar situation. Smith stands to inherit a large fortune if his 6-year-old cousin dies, and Jones stands to inherit a similar fortune if his own 6-year-old cousin dies. Smith's cousin is taking a bath. Smith walks in and drowns him by holding his head underwater. Jones sets out to perform the same act of killing as Smith. But when he enters his own cousin's bathroom, his cousin is already flailing underwater and slowly drowning without Jones's direct intervention. Jones not only doesn't pull his head out of the water, he stands there waiting to force his head back under if his cousin starts to emerge from the tub. Thus, he is fully prepared to deliberately kill. It just so happens this isn't necessary. Clearly, Jones's act is just as despicable as Smith's. Hence, once again, there is no moral difference between killing and letting die. And this is Rachel's argument.